strategy. So validation. Here is something really important about validation and acting out. We do not validate acting out behavior, right? So if someone stands up and throws something, I wouldn't want to say, yes, that makes sense, you just threw that. Totally. You don't want to validate acting out behavior. I know that you guys know this. Because validation serves as a connection, but it also serves as a reinforcer. So we don't want to reinforce acting out behavior. We want to decrease acting out behavior. But what we can do is we can we can validate feelings, right? So I understand you get very frustrated when someone tells you no, because you've heard that a lot in your life, right? Makes sense you get frustrated. That's a way that we can still connect, we can understand them, but we're not going to say that behavior's okay. So that's super important that we delineate that. Normalizing acting out behaviors. Again, timing's important on this one. If they just did something like cursed you out, you don't want to then normalize them cursing you out in that moment, because the closer that you reinforce a behavior after it's done, the more likely you are to increase it. So we don't want to validate or normalize after they've just done an acting out behavior. But if I'm sitting there calmly and they're becoming more emotionally charged, then in that moment I can normalize and say something like, well, you saw a lot of violence growing up. So it makes sense that your natural reaction is to become aggressive when you feel threatened. Of course it does, right? Not only is normalizing that helping them to feel less, some folks who act out, I'll hear them say things like, I'm a bad person, there's something wrong with me. So it's going to help them to feel less like a bad person, like a defective person, and also to help say, well, there's a reason you do this. It's not just because you're a bad guy or girl, it's because you saw a lot of violence, so it makes sense that you would then act out in that way, right? So normalizing, I think, could be really helpful in the relationship. And then aligning with long-term goals. So this is really important. When you have someone who's prone to acting out, remember they've learned this from somewhere. So we want to consistently remind them of their long-term goals. That's why you're here in treatment. And not only that, but this is something we've gotten from them already, right? So remember session 1, session 2, we've identified their goals with them. So then I can go back and say, well, remember you mentioned that you wanted to work on managing your anger differently? Are you open to learning new skills to be more assertive and less aggressive? Because right now that would be the time, right? And you can, in the session, in the moment, teach them how to breathe through their anger, identify it, and then communicate assertively versus going to that autopilot place that they usually go to, right? So consistently using their language, their words, their goals to help ground them and bring them back. And then problem solving. So this goes back to what Dr. Heather was saying, how when a patient gets activated or a human being gets activated, their amygdala, right, goes offline, and suddenly the prefrontal cortex kind of shuts down. And the prefrontal cortex is our problem solving, our organizing, our implementing, organizing part of our brain, right? That part gets suspended when someone's highly activated. So when someone's overwhelmed, they're not problem solving the way they normally might. So we want to help them with that. We want to help them learn how to calm down, but then also to problem solve effectively. So asking questions like, the next time you notice the urge to yell at your wife, what are other options you have in the moment? And you really want them to think about it, because the idea with patients is that they have the answers inside of them, right? We are here to teach them skills, but they have a lot of the answers inside of them, so we want to help them to access those. So yes, in summation, building rapport with someone who's engaging in acting out behaviors. So now we want to look at the function. What is the function of these behaviors? So again, pros and cons, same thing. We kind of went over this with avoidance behaviors. What are the benefits of this behavior? What are the consequences? And for this slide, I'm going to focus on the patient who tends to talk about suicide as a problem-solving strategy, okay? So what are the benefits of thinking about taking your life? And what are the consequences if you act on these thoughts? It's really key here, I think, with someone who has suicide as a problem-solving strategy, that you want to get to know why. Why is that their answer? And it could be different, right? We might think we know. Is it really that they want to die? Or is it that they just don't want to be in that pain anymore? They want to escape that pain? Because we have strategies to help people get out of pain, right? So we need to know why, what's the reason that you want to die. And pros and cons is not only going to help us so we can be more effective clinicians, but it's going to help them to understand, why do they go to that place? Did I see that growing up? Or I'm just in so much pain I don't know how to deal. And immediacy, I really like this one. I think this one is one of my favorites in therapy. It's about being in the moment and addressing what's happening in the relationship. So this kind of brings up process versus content. So let's talk about that. Content in a relationship is what's being said. What the patient says, what I say, what the patient says, what I say, right? Process is all the nonverbals that are going on, all the interactions, the engagement, the things that aren't talked about in the moment. And who can relate? Let's be honest. Have you ever been in an interaction with a patient and something was going on and you've seen it before and you knew it was going on and you just didn't say anything? You just kind of watched it happening like a train slowly wrecking. Is it only me and that guy? Oh, okay. Oh, Kelsey again. Okay. Everybody, right? Everybody has been in this situation where you're seeing something playing out in the moment and you don't say anything. Why? Because it's hard to speak up sometimes. As a therapist, we have to have a voice in the moment and sometimes the courage to say, what's happening right now? I'm trying to talk to you about your mom and I'm noticing, this is going on. So something that you could say is, I've noticed a pattern that when I ask you about your drinking, you start crying and say that you don't want to live. What's that about for you? Right? So the important piece with immediacy is to flag patterns. So we're always observing, noticing patterns of behavior, and then being able to not only identify the pattern, but then to speak on it and flag it in the moment. And nothing is more powerful in therapy than identifying the pattern as it's happening, because that's where we have the power to make the changes and to teach them the skills that they need to know. So that's a super good one. Behavior contraindicated with long-term goal. This is kind of like the dialectic, right? But you told me that you want to learn how to deal with stress effectively. And I'm wondering how going to suicide as an option is going to work towards that goal, right? And again, we want to be mindful of how we say that. But honestly, you've been telling me you want to work through this, but then you go to suicide. How are we going to work through this when you go to suicide? And really helping them to see that being able to tolerate those feelings and talk about those things that are uncomfortable is going to be what it is, what we're going to have to do, and showing them that this is a safe place where we can teach skills and help them to kind of go into that without overwhelming them too much. So now the last part is setting limits and challenging. So these interventions, I think, I could be way off, but for therapists, I think these are the more challenging interventions to apply, because it not only requires the immediacy of dealing with something in the moment, but it requires being very firm and directive. And a lot of us as therapists are in this field because we're compassionate, we're sensitive, we care for people, we're loving, we want to help others, yeah? Any callous, cold people in the audience? No? Okay. Yeah, that's why we're here, because we want to help. But this is one of those times when someone's acting out, it requires a different part of you to come forward. So the directive approach, right? When someone is acting out, becoming verbally, physically aggressive, threatening to self or others, whether it's in the room with you, whether it's with their family, whether it's with a group, you want to be very directive, right? You want to set firm limits, and you want to do that in a way, you could say something like, it's not okay for you to talk to me like that. I need you to sit down and lower your voice. And you want to be in charge. Because think of it like this. Sometimes when we're in a really depressed state, people become kind of regressed and childlike. Not because of anything other than that's just emotionally where they're at. And children need firm limits, right? And I'm not saying all patients are children, but what I am saying is when someone's losing control, you want to make sure that you're in control, because that creates a sense of safety. And whether the patient communicates it to you directly or not, they actually want that. They want to know that no matter how bad it gets for them and how terrible it is, that you're going to be in control. Because when you start losing control, they start feeling like it's no longer safe. So that's kind of our job, is to be the ones that can be directive and firm, even though it's uncomfortable, to do that, to create that safety and security for patients. And the next one is along those same lines. It's called the illusion of freedom, or illusion of choice. They're synonymous. So the illusion of freedom is basically what you might do with a child when they're misbehaving. You'd say you have two options, right? So I'm giving you choices, I want to empower you, but it's an illusion because I'm still in control, right? Again, important when someone's losing control so that there's safety. So for example, you have two options. You can either lower your voice and speak calmly towards me, or you can excuse yourself and take a break outside, okay? That's because in this room, it's gonna be safe. And so in order for it to be safe, this is what you have to do, right? In the moment, do you think someone's gonna like being told that? No, I don't think anybody likes being told that. But that's okay. Sometimes we're gonna have to do stuff that people don't like because we gotta keep it safe for other group members or for ourselves or for whomever. So this one's really important. And what I like about this one is it is empowering to some degree because the patient gets to choose. They get to choose, okay, so I can either choose to calm down right now or I can leave. And I'm not telling them which one to do, I'm saying it's on you. You get that choice, okay? And this is another one that could potentially be empowering. It doesn't seem like it, but it could. So it's called vacation from treatment. And what this one basically is talking about is that sometimes in therapy, we're gonna have patients who continuously kind of bend the rules, test us, and push limits over and over again to the point where we're not really sure that they're bought into treatment. We're not really sure that they're working with us. And so what we want to do is maybe offer a vacation. And the vacation is not us kicking them out, but it's saying, you know, maybe right now it's best if we take a break from treatment to give you time to decide whether this is going to be a priority for you or not. You know what we have to offer. You know what I'm asking you to do. So you let me know if you need to take a break, and when you're ready to come back, you let me know. So I'm empowering the patient to make a decision for themselves. Because any times we reject, or excuse me, when we kick them out, in my mistakes that I've made when I've asked a patient to leave treatment, because we've had to do that, you're kicking me out, you're rejecting me, you're abandoning me, right? And that is how it's experienced. So with the vacation, it's more, you know, this isn't working for you right now, and I want you to get the best treatment. So maybe you might want to take a break, and you let me know when you're ready to engage. Yeah?
How do you do that in an inpatient setup?
Oh, yeah. You would have something like that.
You beg someone to take him for a heat.
Conservator? I don't know. That's a tricky one. Maybe you can just take a vacation from them. Say, I'm gonna take a break. I don't know if I'm doing what's best for you right now. Yeah, inpatient's a little different, right? But that was a good question. Irreverence. So this is a strategy. So we have to thinking about acting out behaviors and the function of acting out behaviors. Maybe the function is to get a response, right? For someone who comes in and they're from a highly conflictual home, and how they engage is to fight and to argue, and then how they know that you care about them is to fight back with them and to argue with them, right? When they argue with you, they may be trying to elicit your love. They might be trying to elicit your attention. So irreverence is, I'm not going to engage with that behavior. I'm not going to give them that response that they're looking for, because remember, I'm trying to decrease that behavior. And if I engage with them, I'm only serving to increase it, which is why we have to have the conceptualization to know that the patient's doing that. So taking things lightly or questioning their thoughts. So for example, let's say I have someone who's criticizing me, and I just say, you know, maybe you need another therapist. Maybe I don't have what it takes to meet your needs. Right? I don't have to say it in a defensive way. I can just put it back on them, like maybe this isn't working for you. And irreverence is to keep your face kind of just, you know, not particularly empathic, not particularly anything, just kind of, well, maybe you need another therapist right now. And that usually causes the person to reflect back on their behavior because they're not getting from you what they want. So then they're going to think back like, well, that didn't work.